if your portfolio can lose, and at the same time, that's when you need to take money out, you're doubling down on your losses. The typical plan isn't going to work. Typical focus on long-term care insurance is too expensive at this age. The typical plan of, I'm just going to withdraw, that's the road to bankruptcy. What's the solution? Hello, wonderful audience. This is Colin Richards again, and we're back here at the Lord and Richards Show, and we're talking about the challenges of living longer and how to get ahead of especially the financial difficulties associated with that. I love the idea of living longer. I love the idea of doing more with those that you love. But the reality is, as we get older, our healthcare costs rise. And most people are not prepared for this. And so at Lord and Richards, we're going to help you develop a written plan to make sure you don't leave all your money to the government and healthcare institutions and nursing homes, okay? That's where it's going to go. That is where it's going to go without a written plan. And you say, Colin, why do you keep saying written? Well, guess what happens to plans that never get written down? They never get implemented, right? So we're going to write it down and we're going to implement it for you. We're going to take all that heavy lifting off of your shoulders. And here's why it's so important. Average healthcare costs today by themselves, if we're just talking about the normal stuff that's covered by your health insurance or your Medicare and your supplements, the average 65-year-old is paying over $500 a month in copays and other premiums. That's just the reality. By 95, you can expect a healthcare inflation rate of 6% or more. Has your current financial planner taken that into account? Or do you even have a financial planner? Or are they just a broker or, a life insurance agent? At Lord & Richards, we're fiduciaries. We're comprehensive financial planners. We're going to help you develop a plan so that you're ready, because the healthcare costs that cost you about $500 today, by 2052 are going to run you about $1,475 a month. Wow. The end of retirement, you're going to be paying almost triple what you are today. Does your plan account for that? This is the number one cause of bankruptcy in retirement. We've got to get ahead of it, folks. Now, one of the other areas of real concern from a healthcare standpoint is not just your typical healthcare costs, going to the doctor or going to the hospital or having surgery. It's the costs that nobody wants to pay for. By nobody, I mean your health insurance, your Medicare won't pay for these kinds of costs. Do you know what they are? It's called chronic illness. And solutions are out there. They're called long-term insurance policies, long-term care insurance policies. And by that, we mean the kind of care where you can't do two or more activities of daily living, like feeding yourself, bathing yourself, and so on. Or if you have cognitive impairment, your Medicare isn't going to pay for that. Did you know that? After 90 days, it's coming out of your pocket. That means it's going to put a severe strain on your budget. Now, some folks think they might be prepared and can maybe handle that cost. Guess what? As part of your financial independence review at Lord & Richards, we're going to help you assess that, right? Because these costs are huge and going up every single year. Today, if you just want a home health aid, if you just need a little help getting around, if you're in the early stages maybe of some of that decline, that's about $32 an hour here in Colorado, and in other states, it's similar. And the average cost of skilled nursing is over $113,000 a year. Wow. That is a lot of money that's going to come out of your pocket and not be paid for by Medicare or your health insurance. You say, well, my odds are pretty poor that I'll need that. I exercise and so forth. Well, good for you. You've put yourself into the elite class, but here's the real probability of needing assistance with two or more activities of daily living, or in other words, having costs that aren't paid for by Medicare, average 70% for a couple. If you're a man or a woman, it's 64% and 75% respectively. Holy cow. That is a high probability. And I got to tell you, years ago when I realized this, I immediately started making sure we address this with every single client. And it can be addressed. You don't have to go out and buy long-term care insurance. Most of us, by the time we need something like that, or even thinking about it, it's already so expensive we can't afford it, right? The odds of needing 3 or more years of care averages out to about 62%, 2 out of 3. are going to need long care that's not paid for by anybody. So what are we going to do about that? You say, well, I'll draw it out of my portfolio. And you know what? We'll test that for you. And there are some blessed clients who have socked away so much that they could take hits like that, but most can't. And here's what happens is if you're doing that with your typical advisor setup portfolio, like a 60-40 portfolio, 60% stock, 40% bonds, or vice versa, when you withdraw assets en masse during down markets, we call that dollar cost ravaging, right? Not averaging. That's the scheme that the 401k companies figured out to make sure you put your money in their 401k to slowly drip your money in. But this is dollar cost ravaging, because if your portfolio can lose and at the same time that's when you need to take money out, you're doubling down on your losses. The typical plan isn't going to work. Typical focus on long-term care insurance is too expensive at this age. The typical plan of I'm just going to withdraw, that's the road to bankruptcy. What's the solution? Well, there's a first line of defense. Number one, go back to my discussion on being a distribution specialist and the fact that Lord & Richards is going to provide you with some downside protection, right? We actually will put our money where our mouth is. It's called a safety percentage. It's a safety guarantee that says we will sit down together in advance of all these kinds of things happening, market drops and long-term care, and we'll determine your downside risk tolerance, how low you're comfortable seeing your portfolio go without getting anxious, nervous, or wanting to make a change. And we're going to draw a line there. And we're going to actually guarantee that we won't go past that. And if we do, we're not going to charge you fees. There's nobody doing that. So that's your first line of defense, right? Is don't have severe market drops so that if you do need to withdraw extra money from your portfolio, it won't destroy you. Get defensive as well as offensive. Now, this doesn't mean we give up on growth, but it just means we do it a different way. And at Lord & Richards, that's our specialty, you see. We're not a generalist. This is our specialty. And there actually are products and tools out there that can help you, that can actually create pools of money that you don't already have. In other words, spending somebody else's money. You say, well, that's like a long-term care policy. Well, there's also products out there where you can take income, such as an annuity, and they'll double that income while you're in a nursing home. That's pretty cool. Or maybe even at home, getting home care. So what if you could suddenly take your income and double it during periods when you're going through a crisis that is financially disabling? That's a pretty cool solution, but that's not the ultimate solution. We're going to talk about that in our next segment. But let's just talk about this reality. If you are counting on taking withdrawals from your normal portfolio to cover the high costs of extended care, these hundreds of thousands, and by the way, by the time you retire, if you're now in your 50s, this is going to be like $1 million bill. We're talking for 3 to 4 years of care at the rate of growth of healthcare costs right now. If you're just in a typical portfolio, assumed to average 7.2%, it looks pretty good if you take 5% out. But do you know that that same portfolio averaging 9.5% would run out of money a decade earlier if it actually followed the historic returns, the ups and the downs? You see, that's the effect. Oh, yes, we get these little reports from our advisors say, oh, if you average 7, you'll be fine. Nobody averages anything. Everybody gets specific returns on specific dates. And if you're down when you're pulling out, you are actually going to run out of money faster than if you were just comparing this to an average portfolio. So folks, we got to get ahead of this. In my next segment, I'm going to get real down to brass tacks. I'm going to talk to you about exactly what we need to do. In the meantime, I want you to pick up the phone and give me a call, because this is critical to get solved, along with the other major critical issues in retirement, such as never running out of money in your normal income distribution plan. Forget about healthcare, just making sure your normal income distribution plan works, and it works for life no matter how long you live. So I would love to chat with you. My advisory team would love to chat with you and help you take the next step forward. It just starts with a simple phone call.